Well, society is getting sicker and sicker from our high sugar processed diets, all the pharmaceuticals that we pump into our bodies, and I'm sure there are other things contributing to our decline. And as boomers age, we're going to see more and more needing assisted living facilities. And if you've ever been to an assisted living facility, it could be pretty nightmarish. If you've ever been through the process of looking for a facility, you understand just how nightmarish many of them are. And if you haven't yet, consider yourself lucky, but the time could soon come if your parents are aging or if you're aging yourself. One of the big questions about these facilities is what do they do to help people live their last days in a fulfilling way rather than just pump them full of meds and wait for them to die? Well, our guest tonight is Hal Cranmer. Hal owns and operates 4 residential assisted living homes around Phoenix, Arizona called A Paradise for Parents, but they're not just any assisted living homes. Hal has found a better way. He himself is a health nut on a carnivore diet, which we'll ask him about. And he didn't buy into all of the pandemic nonsense, which is particularly a feat when you're running assisted living facilities, which we know were hit hardest with COVID. But his weren't, and many of his residents didn't even take a vaccine. In the 9 years that he's been running assisted living homes, he has helped countless residents become healthier, and some have even been able to go home. Watch this.
We vowed we would never let our residents sit in front of a TV all day while we watched them decline. We wanted to fight for them to be their very best every day. To that end, we've been partnering with top-notch medical professionals and nutritionists to bring our residents to the best state of health we can provide, while at the same time having fun, and helping them exercise 4 to 5 days a week with our personal trainer. And we've seen amazing results. Several of our residents have even moved back home. Now we're trying some protocols that mitigate the effects of cognitive decline, including Alzheimer's.
I am doing red light therapy. I'm also doing sauna. Good supplements. I've also had the opportunity to go in the hyperbaric chamber, which was wonderful. As I said, I can just feel my body is healing. I'm steady on my feet. I have most of my memory back, which is pretty amazing.
Yeah, so pretty amazing. What does Hal do that helps these residents get healthier, and how can we help our aging parents or ourselves stay out of assisted living? Hal is in the business of actual health care. I like to say health care, not what they call health care today, which is absolutely just sick care. But first, let's get to our sponsor. You guys know that everyone's talking about those weight loss injections because the results are really dramatic, and they work by lowering blood sugar and reducing appetite. But what if you need to lose weight, but you don't have the money or you don't want to take those shots? Well, that's why doctors created a weight loss supplement called Lean, and the results are remarkable. The studied ingredients in Lean have been shown to lower your blood sugar, burn fat by converting it into energy, and curb your appetite and cravings so you're not as hungry. But listen, Lean is not for the casual dieter with only a few pounds to lose. The doctors at Brickhouse Nutrition created Lean for frustrated dieters with 10 or more pounds to lose. So let's get you started with 15% off and free rush shipping. All you got to do is, because you want to add this to your diet and your exercise plan, just go to takelean.com, enter Kim15 for the discount. That's promo code Kim15 at takelean.com. Hal, welcome to the show. Thank you so much for being here.
Thank you, Kim. It's a real pleasure to be here. I've followed you for a long time and love what you're doing.
Oh, thank you. Thank you. This is going to be a different conversation for my show. I typically, obviously talk politics all the time, but I think this is such an important discussion to have about aging. We're all going to age. Hopefully we're all going to age.
Yeah.
Our parents are aging, and needing care. So whether it be our family members or ourselves, we're all facing this prospect of what do we do with our aging family members? And I think a lot of people don't think about it until it's time to think about it. They really should think about it in advance. But your facilities fascinate me because, people just think you get set up into an assisted living facility and you go there to die. That's it, right? But you've been successfully getting people out and back home. That seems pretty unique compared to the norm.
Yeah, I think it is. There are a few others like me around the country, but very few. And when I first got into this business, that's what they told me was we're going to basically warehouse them, give them medications, make them comfortable and for the rest of their lives. And I didn't want to do that. I said there's a better way. And I don't send everyone home by any means. I've only sent a few completely home over the years, but even if we can improve their quality of life to where they can go out to dinner with their family or go home for the weekend or go home for the holidays, it's a big win.
Yeah, that is a big win. So tell us about how did you get to this point and then how did you figure out strategies to help people get healthy?
I did my own research, which you're not supposed to do, right?
Yeah. Yeah, you're supposed to
Uh,
just trust the doctors and the science and not do any of your own research. How dare you?
I, I think we all learned during COVID that it might be worthwhile to do your own research a little.
Yeah.
So, when I first got into this business, I don't have a healthcare background. I actually came in this business from a manufacturing background mostly. And um, I was trying to just learn the business, all the regulations, the healthcare directives, meet doctors, be able to fill my homes with someone, that I can get revenue flowing and everything. And so I really didn't concentrate on what I could do to make them better. At first, I just wanted to do what everyone else was doing. And then I
Mhm.
realized if I do what everyone else is doing, then the only advantage I have of people moving into my place over someone else's is price and location. All the families want to be near their mom or dad so they can stop by
Mhm.
after work and see them. So I'm only going to be able to appeal to a small area around my homes. And, if there's another home nearby, who's the cheapest? We're doing the same thing, right? So why would you go to my home over theirs, you know, other than I want to pay less money. So
Right.
I thought, okay, I need to differentiate myself. A. Secondly, I've always been into keeping fit and keeping healthy and everything. And I thought, well, we don't really do what I've done my whole life to stay healthy is try to eat right and exercise. There's some of that. We have physical therapists that come when someone gets discharged from a hospital or rehab, they'll get assigned some home health or something like that. And they'll get 5 or 6 sessions of physical therapy, which, if you've ever worked out, that that really doesn't do anything for you
Right.
long term. And meals, the Department of Health, their big concern is that you have a menu posted. What's on that menu? No one really cares. So I thought, well, we can do better than this. I'm very regulated in what prescription medications I can give and what the doctors prescribe. We have to, the Department of Health inspects us and makes sure that we're meeting their directives to the letter, which makes total sense. But there was a lot of flexibility in everything else. They're more worried about is anyone getting abused in your facility? Because unfortunately, this industry has a big reputation for that. So I just thought, here's how I'm going to differentiate myself, A, and B, it just seems like the right thing to do.
Mhm.
Um, so these people are sitting around watching TV all day, or maybe someone will come in and play bingo with them, but that gets pretty monotonous too. So why not give them some purpose, give them some reason to live of let's see if we can make you better. You've got grandkids, you've got kids, you've got some of the cases great grandkids. Wouldn't you like to spend time with them? And that is the ultimate purpose in life to me is to spend time with your family. Even if you don't have a family, you've got friends. You make friends in our assisted living facility. Wouldn't you want to be around for them? So that's kind of what drove me to go down this road.
Okay, tell us about why people get placed. What is it? Many people die at home or they, at the hospital. They never have to go into assisted living facilities. So, what is it that would cause a person to get to the point where they need assisted living? What type of conditions?
Sure. Let me preface that with everyone wants to live at home. Everyone wants to die at home. No, you could have the fanciest assisted living home and facility in the world, and people still, well, maybe someone would want to go there, but you're going to pay a ton of money for it. So the reason people, the difference between staying at home and going to assisted living is you need 24/7 care, or you need extensive, someone watching you most of the time, if not all the time. And most families can't do that on their own. You know, they work, they have kids, they call them sort of the sandwich generation, you know, the sons and daughters of people who need a lot of care also are raising children, also are working, and they can't be up all night with their parent and then go to work the next day and get their kids on the bus and get them to sports and still take care of their parent. So you have two options really. You can hire someone in your home, which can work pretty well, especially if you use them for just a couple hours a day, maybe make some meals, do laundry and stuff. But when you start talking 24/7 care in your home, and you just do the math of you're probably going to pay them 20, 25, $30 an hour times 24 hours a day times 7 days a week times 30 days in a month. And then, you know, if they're over 40 hours a week, you're into overtime. And
Yeah.
there's a lot of hours beyond 40 in a week. Um, you're looking at sometimes $15,000, $18,000 a month for care. Now, there are ways to figure out, you know, we'll trade you rent for stuff and get them. But ultimately, if you put them in an assisted living setting, now we have one caregiver that takes care of several residents at a time. The economies of scale start kicking in, and
Hmm.
it becomes much more affordable to have that care and have them in a facility.
Okay. So what types of conditions get a person to that point? Like, what are we looking
Uh,
at?
you're basically looking at chronic diseases. Um, the you know, very elderly just can't get up and move on their own is a possibility, and becoming maybe incontinent. But the big ones are Alzheimer's, dementia. But you're looking at Parkinson's, ALS, fibromyalgia, a lot of severely diabetic people who may have lost their eyesight or a limb from their diabetes that had to be amputated. Um, let's see what else. I've had Huntington's disease, a lot of the chronic diseases you hear about, Crohn's, ulcerative colitis, a lot of those, there's multiple comorbidities amongst the assisted living population. It's not just one problem they have, it's usually several. And they want us to just manage it for the rest of their lives. Uh,
It's tough. I have family members right now in memory care facilities, you know, especially when they start to lose their ability to know, you know, because I think the danger in particular is that they'll get up and they'll start wandering the streets, you know, at from home. They'll not realize where they are or what's going on, and they'll start wandering, or you know, and then you have to go and find this person, and I understand the 24/7 needing to watch them because they'll escape kind of in the middle of the night. um, and that's really traumatizing, I think, for people, especially they don't know who their family members are anymore. It's, you know, extremely challenging. um, so, but that's how would you get, what kind of care? So just, you know, this, I'm kind of interested in talking to you also just on a personal level. And I know a lot of people watching have very similar situations, especially it seems like more and more people are being diagnosed with memory issues. I feel, and younger, it seems to me. That's just, I don't, or maybe I'm just getting older. And so people
No,
in
you're
my
not.
life.
It's so completely true. I mean, I think a lot of people are starting to speak out on this topic because if you look at rates of all diseases, you look at rates of obesity, you just look at rates of poor health in general, it's amazing. I mean, I was in the military to start my working life, and I think it's something like 27% of the population is physically eligible to go in the military right now in the United States. I mean, there's there's all kinds of health problems, and they're getting younger and younger. I had a person in my assisted living home with dementia in her 40s. So there, it's hitting more and more. And a lot of these chronic diseases like dementia and Alzheimer's start in your 30s, 40s, even in your 20s, but they don't start showing symptoms until later in life.
Yeah.
And if you go down the path of poor health early in life, it's going to condemn you to my facilities or someone else's later in life, if you even make it that far.
What
It's
do you
really
say?
sad.
So you've done a lot of research on health. I know that you're a big health nut. Are you on a carnivore diet, like a pure, what's,
I don't, I'm 90%. I mean, if I have family over and, none of them are on carnivore or something, I'll cheat, but I'll do as best I can on it. I probably am under 50 grams of carbs a day. And I've been
wow,
doing
okay.
that for about 3 years, and I feel like I'm 57. I feel like I'm 25.
What do you eat?
Mostly steak, eggs, ground beef. I grew up in New England. I'm a big fish fan, but I stay away from the top of the food chain fish. I'll eat salmon, sardines, oysters, things like that. And I just,
What do you eat? What do you eat for breakfast? Like, give us a day of what you eat. I'm just
well,
so
I
curious
usually,
on this
yeah.
diet.
So I usually don't eat breakfast. I used to
Okay.
be a huge cereal nut because I thought that was really healthy. It's not. Um, so I usually don't eat till noon or 1. I haven't eaten today. And I'll eat in sort of a 6-hour window. I'll have about 10 eggs, either sort of scrambled or fried. And then I'll maybe have some bacon with it sometimes. And then later in the day, after I'm done working and stuff, I'll cook myself a steak. I'm in Arizona, so I can grill year round, and I'll grill a
Mhm.
steak. Or I grill one for my wife a lot too. Sometimes we'll just get hamburgers from the store. I don't put anything except salt on the hamburgers. I don't eat them with buns or anything like that. I don't put veggies on them. I don't, or we'll do, or like if I'm out of my homes and stuff, I'll bring a pack of salmon, a can of sardines, a can of oysters, and just eat those. You start thinking of food as fuel much more than you think of it as this is a treat for me. You know,
Yeah.
like I get to go have wonderful meal or something like that. It's I'm eating this to feel better. One of my favorite quotes is, "Feeling better is better than the taste of any food I've ever tasted." So I just keep that in my mind when I get tempted to get
Yeah.
off track.
I think isn't Rogan, is he on the carnivore diet as well? There's a few, I think, people
He
that eat
goes on
mostly.
it. He goes on
Okay.
it and off again, on it and off it from time to
Mm.
time. But he always says, when I'm on it, I feel the best I've ever felt in my life. There's a doctor named Sean Baker that's a big carnivore doctor, and he's been on Rogan a couple times, and they discuss it. And Rogan says every time he comes on, it's a reminder to him to get back on the carnivore diet.
Is
But
it
yes, there's
different
a
for
lot of
women?
famous people.
Yeah, I know there's a
No,
lot of people that are on it. But
no, it's
is it
not.
different for women? Because I heard something about hormones and women, and it's like a bit different and can't really do the carnivore diet.
No, in fact, the carnivore diet's really good for your hormones. There's another carnivore doctor named Dr. Anthony Chafee, who's a world-class international rugby player. And he talks about his patients, their hormone levels improve when he gets them on the carnivore diet, both male and
Mm.
female. And I don't know if you've ever seen Jordan Peterson's daughter, Michaela. I
Hmm.
actually just went on her podcast, but she was almost at the level of suicide because her health was so bad that it was hard for her to wake up in the morning and not be in a tremendous pain, itching all over her body, just her body on fire, never be able to have children or anything like that. She went on a purely meat diet, which they call the lion diet, which is just beef or ruminant animals. And she fixed everything. And she
Wow.
looks amazing now. And she just had her first child which the
Wow.
doctors told her several years ago, you will never give birth. You're infertile.
Mm.
So it seems to work. I haven't found. I've been told by. I have a health coach in my homes, and she's told me there are a few people that it doesn't work for, and you'll notice it pretty early on in doing it. But and then you should definitely get off it. But the vast majority, everyone I've put on it in my assisted living homes has I've seen excellent improvement with.
Yeah, that's what I was just going to ask you is if you've tried this on anybody at the assisted living facilities.
Yeah, I've done it with some. I have a lot of people who are like, no way, my mom's eating that, and we accommodate that. But
Mhm.
it's usually the families and getting the word out on this. The families, I get calls from people who say, I want my mom on this diet and I want you to put her in there. But I get a ton of people reaching out to me and saying, I've done this with my parents at home and had tremendous success with it. And even if we're not going to necessarily cure their Alzheimer's, but we see them much more active. We see them much more alert. We see them sleeping better. All those kind of indications of health improve with it. And so, I mean, I have cooks that my health coach has taught how to cook these diets and make it interesting and add some variety to it and everything.
Mhm.
Because there's a lot of stuff you can make. We serve carnivore waffles. You know, they
What is
have
that
monk
made
fruit
out of?
syrup. It's made out of I forget the gelatin in it too, and I think some creatine, and then they use egg whites, and
Ah,
it strengthens them, and then they use monk fruit syrup, which is a very
uh-huh.
low glycemic sweetener for the syrup, and they do taste a little different, but they're not terribly different, and
Mhm.
it's really good, especially bringing people in who have been on a standard American diet who have all those sweet teeth and temptations and cravings
Yeah.
and gradually be able to transition. It's really hard to take an elderly person and go, okay, you're just going to eat steak and beef and eggs from now on
Yeah, especially
initially.
as, especially older people have teeth problems often and they can't chew it. I mean, that's a
Yep.
that's a big problem.
So we throw it in the Cuisinart, grind it up, and make steak into sort of very soft ground beef, and we'll give it to them that way.
Thank you so much for watching. This was just a clip from the longer, larger show that you can catch Monday through Friday, 5 p.m. Pacific, 8 p.m. Eastern at KimIversonShow.com. That'll route you to the platform where you need to be in order to get the full uncensored show every Monday through Friday, 5 p.m. Pacific, 8 p.m. Eastern. Click on that link, watch the full interview. See you there.